It is taking the lives of more than 1,000 people every day at hospitals all across the country.
And it's preventable. Natalie Tyndall with 2 News Investigates is shining light on a problem every patient should be aware of.
It's a hidden epidemic that's considered the 3rd leading cause of death behind heart disease and cancer. I found deadly medical mistakes are a problem in this country, and you can't find out how many your hospital has had. One local family shares their story.
I remember when Dad first taught us how to hunt.
James Frock and his brother have only memories left of their father, Edgar. He died nearly a year ago at Springfield Regional Medical Center.
He was in the hospital. He was going in for a bronchoscopy.
But during the common procedure that allows a doctor to look inside the patient's airway, he stopped breathing. And the reason why, which is listed on the death certificate, shocked Frock's family.
And Montgomery County coroner found an atomizer in his chest.
The death certificate says cause of death as a dislodgement of atomizer with passage into airway, meaning that device caused him to stop breathing. An atomizer is used to spray numbing medication in the throat before the procedure. Frock is suing the hospital because he believes his father should not have died.
There's never going to be enough money that'll ever bring our father back. But the biggest thing I want is for them to never be able to do this to somebody else's family.
We asked Springfield Regional Medical Center about it. They released a statement that reads, quote, "Our heart certainly goes out to the family. With the case of litigation, it would not be appropriate to comment at this time." 2 News Investigates found deadly medical mistakes happen more than you would expect. And in Ohio, your hospital is not required to report those mistakes to the state.
Hospitals and the healthcare community needs to be transitioning from that volume-centric to value-centric.
John Palmer is with the Ohio Patient Safety Institute, an organization that encourages healthcare facilities to report their deadly mistakes, but they don't require it. He says they use the data to help hospitals improve. But we found you as a patient can't get access to those numbers.
Why isn't that data available to the public?
Well, a lot of it, I think, has to go around with the culture change. And the fact is that a lot of those medical errors that result in deaths are subject to legal lawsuits from families and patients.
The Patient Safety and Quality Improvement Act of 2005 put patient safety institutes in place with the understanding that hospitals can report their mistakes to them without the fear of knowing it would be made public.
Quality transparency is definitely something that continues to evolve, and there's things that we need to keep in mind with protecting patient information. Legal inquiries or legal investigations.
But 2 News Investigates found because hospitals are reporting medical mistakes on a volunteer basis, it's still hard to get accurate numbers of preventable medical mistakes. The Ohio Institute of Public Safety does use the data they get to compare hospitals and their programs on a public website. But is that enough transparency for patients? Frock says no.
If they don't change something, our society will never want to step foot in the hospital.
When we first started looking into deadly medical mistakes, we couldn't believe how big a problem it is. And we found we're not alone. Several medical experts around the country are asking that something be done. I tracked down one of them, and you can hear what her solution is tonight at 11. Natalie Tyndall, 2 News Investigates.
And while patients do not have access to the medical mistakes data, they can see if their doctor has ever been in trouble with the state medical board. You can find that right now live on our website, WDTN.com. Look for this story under the Investigations tab.